that what exactly epilepsy is. Why God choose me for the epilepsy?
Out of 100, one patient develop epilepsy. So in India also more than 1.35 crore patients are suffering for epilepsy.
Most of the time सबको ऐसा लगता है कि क्या ये सिर्फ जेनेटिक है? After मिर्गी क्या वो लोग शादी कर सकते हैं?
Epilepsy is not a contagious disease.
Is epilepsy is a lifelong disease? Can it be curable? Turn on your volume because RDCC Podcast is officially live. I am your host Nupur Somi. Welcomes you all to the RDCC Podcast episode 1. I welcome Dr. Mihir Parekh sir, who is the neurologist and epileptologist, and he is the very first guest of RDCC Podcast.
To begin with, I am very grateful to RDCC for arranging this wonderful podcast.
Hello sir,
Hello.
and thank you so much for sparing your prestigious time with us today. As your specialty is only with epilepsy, I wanted to dig into the point that what exactly epilepsy is. Like epilepsy को बहुत सारे लोग मिर्गी और गुजराती में तो खेचना नाम થી ઓળખે છે. So I just want to give your insight on what exactly epilepsy is.
Epilepsy means whenever someone gets more than 2 seizures 24 hours apart. Basically, a seizure occurs because of abnormal excessive electrical activity in the brain. So there are different names. In Gujarati we say khech, taan, aachki, vayu. In Hindi we say mirgi. In English they say seizure. So whenever someone gets more than 2 seizures, more than 24 hours apart, it is called epilepsy. So if we see prevalence of epilepsy, out of 100, one patient develop epilepsy. So even if we see Indian population, India have more than 135 crore people. So in India also more than 1.35 crore patients are suffering for epilepsy. Epilepsy will have different symptoms. So depending on the part of the brain from which the electrical activity is originating. So sometimes what complaint we get in children, like they just get pause while looking at the lectures in the school, which is called absence seizure, which is common in the children. And sometimes you get stiffness of the hands, you get jerky movements, and once it continues, someone get uprolling of the eyes, frothing from the mouth, and then tongue bite. So depending on the part of the brain which is originating and type of the seizure, patient will get different symptoms.
Okay, so sir, as आपने अभी just बताया कि there are lots of symptoms of epilepsy. So ये diagnose कैसे करते हैं हम? What is the diagnosis rule for diagnosing epilepsy, I guess?
To diagnose epilepsy, most important thing is history. So we should know from the patient's eyewitness what is exactly happened. Because more than 90% time patient doesn't remember whenever they get an epileptic attack. So apart from history, there are 2 more investigations which supports our diagnosis. First is EEG, which is called electroencephalogram. So like we do ECG of the heart, what we do in EEG, we put different electrodes over your head, which records electrical activity of the brain. How it will be useful? So it will help in diagnosing from which part of the brain the electrical activity is originating. Plus what is the burden of the epilepsy, electrical activity in the brain. And when patient takes medication for certain years, when we want to reduce the medication, EEG will help. Second important investigation is brain scan, like MRI brain. So which help us to know what is the structural problem inside the brain. Like epilepsy has different causes. So whether there is gliosis in the brain, whether there was brain tumor or whether some other abnormality. And sometimes some blood reports, like someone get low sugar, someone get hyperglycemia, some drugs and some alcohol also. So there are some triggers of seizures. So overall history from the patient's eyewitness, EEG, MRI scan and sometimes blood reports. This combined helps in proper diagnosis in the epilepsy.
So sir, जैसा आपने बताया कि there will be the 3 steps which will be considering के first step, second step, third steps to diagnosis epilepsy, right? So after diagnosing, person को ऐसा लग जाता है कि अरे मुझे ही क्यों हुआ ये? Like people have that thought कि why God choose me for the epilepsy? So what is the reason behind this?
So anything that disturbs electrical circuit of the brain that can cause seizure. So if we see common causes, so 12% people have genetic causes of epilepsy. Some children can have developmental abnormality in their brain which can cause seizure. In India we commonly ask when a child gets birth कि बच्चा रोया है कि नहीं. Why it is important? Because if the child doesn't cry, there is a delay cry, then there is lack of blood supply and oxygenation to the brain, and which is a very common cause of not only epilepsy but one of the resistant epilepsy, especially in developing countries like India. Apart from that, in elderly, brain tumors, brain stroke is an important cause of epilepsy. Some of the brain infections like TB and neurocystic sarcosis. It is one of the infection which is more common in some of the states like UP, which is one of the important causes of epilepsy. And some of the electrolyte abnormalities like low sugar, excess sugar, low sodium level, like low calcium level, excess alcohol intake, sudden stoppage of alcohol intake, some of the drugs, and these are other causes of epilepsy.
सर मोस्ट ऑफ द टाइम सबको ऐसा लगता है कि क्या ये सिर्फ जेनेटिक है, जैसे उनके पेरेंट्स को तो नहीं था पर उनको हुआ. सो देयर इज अ वेरी मिसकंसेप्शन ऑफ दैट कि ईदर इट इज अ जेनेटिक कॉज, ईदर इट इज अ एनवायरमेंटल कॉज, और इट इज अ न्यूरोलॉजिकल कॉज. सो व्हाट द स्पेसिफिकेशन ऑफ दैट कॉज?
So as I told earlier also, there are very few epilepsies, less than 12% are genetic. Among genetic epilepsies also, very few are that which will directly come from parents to children. Though it is not common also, but parents should not worry that it will come to their children. In environmental cause, apart from what causes I have told you, one of the important point we say every time, you wear helmet. Why? Because we commonly see head injury. After head injury, there is gliosis or scar happens in permanently in some part of the brain, which is also a very common cause of epilepsy. Other environmental causes are like infections, which I told you, and our lifestyle factors are because our risk factors are not controlled. We develop brain stroke, like we develop heart attack, and brain stroke also can occurs in some part of the brain, then it can trigger seizure.
So sir, ये सारी चीजें डायग्नोसिस और कॉजेज जानने के बाद एक प्रोफेशनल गाइडेंस की हेल्प चाहिए रहती है पेशेंट्स को. सो व्हाट प्रोफेशनल गाइडेंस स्पेसिफिकली दे शुड टेक आफ्टर डायग्नोसिंग एपिलेप्सी?
So first of all, professional guidance needed to make sure it is epilepsy. So because what we see, if 10 to 15% patient, they don't have epilepsy, means they fall down because of other reasons. They have hypotension, you go in heat, you are dehydrated, you have some heart problem, or there are some other causes in which you fall down, or sometimes there is panic attack or anxiety attack. So this patient should not be wrongly on anti-epileptic medication. So professional guidance is needed first to prove it, whether you have epilepsy or not. And once you diagnose epilepsy, so second part will come treatment. Depending on the type of epilepsy, patients should be on particular choice of medication, which is suitable as per their age, as per their other comorbidities. We see patients' weight, patients' occupations, whether they are going to marry, and many other factors before choosing the anti-epileptic. Cost also we see, because this medicine sometimes patient has to take for 2 to 3 years. So professional guidance is needed to best choose of anti-epileptic, how long they should continue, and plus to counsel them that they are not alone, it is a treatable condition, they should be fine and they are a normal human being.
सर क्या एक स्पेसिफिक एज होती है जहाँ पे उनको प्रोफेशनल गाइडेंस लेना मैंडेटरी होता है? इज देयर एनी स्पेसिफिक एज अलॉटेड टू देम?
No. Epilepsy can occur in any age, and everyone should take doctor's help, neurologist help to control their seizures.
Sir, there are very many stigmas I have heard about epilepsy, that most of the epileptic patient will say that after Mirgi, क्या वो लोग शादी कर सकते हैं? There are very myths and misconceptions and stigmas around. So उसको कैसे deal करेंगे सर हम?
So there are many stigmas going on in surrounding. So I would like to highlight a few of the points. So first of all, epilepsy patients are normal patients. They can marry, they can live a normal life. Only thing, there are 23 medications available to treat seizures, but very few are good for safe for pregnancy. So when someone want to plan a marriage and pregnancy, they should consult their doctors 3 months priorly. So doctor will change the medication which are safe for mother and baby. They are normal people. There should not be stigma that they cannot marry. So they definitely can marry and they can live a normal life.
एंड सर सोसाइटी में जब सोसाइटी की बात आ ही गई है तो सोसाइटी में बहुत सारे मिसकंसेप्शंस ऐसे भी हैं कि पीपल विल से कि या आ तो છે ને ચેપી રોગ હોય like a smallpox કે જેનાથી અડવાથી ફેલે. So is this epilepsy is a infectious disease?
So answer is 100% no. Epilepsy is not a contagious disease. Epilepsy is not a psychiatric disease also.
Okay, sir. Most of our listeners want to know that epilepsy patient can drive, can swim, can do the daily living chores on their own or not?
So driving is restricted for some time in epilepsy patient for their safety and surrounding people's safety. So there are different guidelines in different countries. If we see US and other countries, patients are allowed after 6 months of seizure prepedium. But India, the guideline is different. Swimming is prohibited in epilepsy patient. It is only one of the sport which is prohibited, because if you are swimming, you get unconscious, they can aspirate water. Apart from that, all other sports they can do very nicely. There is no restriction. They can eat all the foods, and that also there is no restriction, and they can do their work, their job, except that they should avoid working at heights and working with sharp objects for their own safety.
Is epilepsy a lifelong disease? Can it be curable?
So, if we see current medical science, so there are more than 23 medications are available to treat epilepsy, and 75 to 80% patients are seizure free by appropriate choice of medications. So if we see duration among this, so it depends on the causes of epilepsy. Few epilepsy, they have to take just 3 years medication, and then we slowly, depending on their EEG and MRI finding, we slowly taper off medications. Only few epilepsies are there in which they have to take very longer time medications. Now, if we see remaining 20-25% patients, which are called drug-resistant epilepsy, means even if they are on 2 properly chosen medication, they continue to get in between seizures. So for this resistant epilepsy also, we have advanced treatment available. So this is called epilepsy surgery. Means what is epilepsy surgery? We do advanced video EEG, advanced MRI, PET scan, neuropsychology. After all this analysis, we found a single focus in the brain responsible for originating of the seizure. So with surgery, we have to remove that single focus. So with properly selected patients with epilepsy surgery, more than 80% are seizure free. If someone is not suitable for surgery, they have also ketogenic diet, neuromodulation in the form of vagal nerve stimulation, responsive nerve stimulation, and deep brain stimulation. So there are various options available for few of the resistant patients, but generally 75 to 80% patients are very nicely controlled with medications.
Very nice. Advancement in technology has boosted a lot.
Yes.
So can we blame advancement in technology that this is the only reason why the epileptic patient ki quality of life has enhanced?
Yes. So advancements in medication, newer medication, very less side effects, awareness by the patients, awareness of the society. Plus, if generally we see anxiety and depression, so they are also a bit more common in epileptic patients compared to normal population. But with therapy, counseling by doctor, by the professional bodies, and surrounding friends and family, most of the epilepsy patients are doing well. They are living a normal life.
It was really a very insightful conversation with you, sir, and I got to know most of the questions about epilepsy. So thank you so much for spending your time with us today.
So before ending, I would like to tell something to my audience. Tell you few names which are very popular names. We all know John T. Rhodes. So he is a great all-rounder. He can play most of the sports. Then Alfred Nobel, Leonardo da Vinci, Napoleon. So we all know these great people. They all have epilepsy, but they did very well in their life. So when God takes away something from you, they will give some special power. So you should live a normal life.
So thank you so much for joining us today to hear the RDCC podcast, and stay tuned and like, subscribe and share for more knowledge and update.
आटले नजर रखें बोल.
Okay. अब पहले चालू करूँ?
हाँ पहले स्टार्ट करके भी आगे नजर रखो.
That side, okay.
Exam नहीं रहा है, the one person is answering.
Catch.
आज की
तान.
वायु
मिर्गी.
सीजर.